This Brewing Brilliance episode discusses the topic of suicide. In this episode, we will be following the Samaritans guidelines on media discussions on this topic. Please find in the description of this episode links to sources of support for mental health and the report on the national rate of paternal suicide in the first 1001 critical days discussed in this episode. Hello, and welcome to Brewing Brilliance, a podcast where we talk to academics from across the university who are involved with the Healthy Ageing and Chronic Conditions Research Institute. We will be speaking to researchers who are leading innovative, interdisciplinary approaches to promote lifelong health, delivering improved interventions to manage chronic conditions more efficiently. These sessions are essentially opportunities for us within the Healthy Ageing and Chronic Conditions Research Institute to meet colleagues from across and beyond our faculty to foster knowledge sharing, collaboration and networking. Today, I am joined by Dr. Kate Ellis-Davies, who is a psychologist focused on the study of mental health, well-being and development across the lifespan. This includes the transition to parenting, the transition to school, university, menopause, retirement and transitions in health. Kate's research is applied and interdisciplinary, working with the third sector and collaborators across fields of psychology, anthropology, data science, sociology and public health in order to develop the strongest evidence base to support policy and practice. Building on her research, Kate is the chair of the Interdisciplinary Perinatal Mental Health Group and the Student Wellbeing and Outcomes Research Group, while being the Programme Director for Psychology undergraduate programmes at Swansea University and the lead of the new Centre for Applied Reviews in Evidence. Hello, welcome and thank you for joining us.
Thank you.
So we're going to be talking today specifically about a piece of research that you've had the results for, and I want to get this right. So can you give us a little bit of background before we dive into it?
Absolutely. So my research looks at mental health and wellbeing across life transitions. And one of the biggest life transitions is this transition to parenting. And a piece of work that I've been working on for a long time is different projects looking at men's mental health and wellbeing across that transition to fatherhood. And we can look at the research that's shown us the impact that fathers have on children. And we can look at the research that's already shown us that that transition can be a rocky one for some dads and it can impact their mental health, their relationships. But what we've been missing is what is the rate of paternal suicide in that first 1001 days. So that's the period of pregnancy and then 2 years post-birth. And we have that data and it's nationally reported. And there are interventions in place targeting this area for women's mental health during that period. But we haven't had any of that in place for men. So this was a really important piece of work for me. And we were funded by 1001 Critical Days Foundation, which was just a beautiful crossover and magical link between their focus on that 1001 critical days and the desire that we had to do this piece of research. So we had a grant from them to uncover what the national rate of paternal suicide was in that first 1001 days, along with my collaborators and John and Kim Dinas here.
So this is then, your report is actually one of the world's first calculated? Mm-hmm. Wow. And that's the statistics that you've had in that then, they've been staggering, I assume, have they? So can you, you've talked a little bit about what that first 1001 is, but can you just say exactly what that is?
Mm-hmm. So the terminology can get really confusing.
Yeah.
But when we talk about the first 1001 critical days, that's the whole of pregnancy, so that 9-month period. And then it's the 2 years after birth.
So how did you identify and measure this then?
So the area looking at perinatal mental health is really an international global effort filled with fantastic people across multiple disciplines. So you have people working in this field from psychology, from antenatal care in terms of obstetrics and gynecology, in terms of health visitors and midwifery. It's a really expansive, wonderfully inclusive area. And there are areas where people are really underrepresented. So some of my research is on parents that have gender or sexual minorities, for example. And that still needs lots of focus where it doesn't get as much as I think it should. Ethnic minority groups are underrepresented. But overall, this is a really dynamic area that really pushes for evidence-based practice and policy. But there has been this real frustration in the field where however many studies have been going on showing the impacts that dads have on their children in the short and the long term across the lifespan. And however much research we have on the impacts that that transition to fathering has on men's mental health in general, it hasn't really seemed to move the needle globally in terms of evidence-based practice, policies, provision. So that knowing that frustration was there across the whole field, we knew that one of the reasons for that frustration is that we don't link having a child to men's health records. So whereas for women's health over that period, it is linked in the health records. So you can really track it much easier at national levels, local levels. So we were really, really fortunate here that we have access to the SAIL data bank and SID Cymru as well, which are phenomenal data sets, and allowed us with the team, with Anne, in the National Centre for Suicide Prevention as well, to do data linkage. So we had to come up with data linkage across this data set, linking birth registry, death registry, household data as well, to uncover the dads that were parenting these babies born across this period, so from 2002 until 2022 as well, and then linking in, sadly, how many losses there were of men's lives in that period, and then looking at the reported causes of death there as well. So without that wonderful data bank and the wonderful skill sets of the analysts working with the data sets as well, we wouldn't have been able to uncover for the first time a national rate of paternal suicide.
And it's like you said, it's the dads that there's not always recorded, is it? Because you have your midwife checks and things like that, but there's nothing to sort of check in.
And I think there are wonderful, incredible grassroots charities. So Dad Matters is one, Samaritans is another, for example, that do an awful lot to raise not only awareness. So I think awareness is often a lofty goal that research has in the applied fields, and that's fantastic. But if it doesn't come quickly followed by or at the same time as evidence-based practice and policies that support those people, it's not sufficient. Awareness on its own is not enough. So we know that these charities have been crying out for having some handle on the level and scale of the issue.
So in your report, you've got all the statistics and figures in there, and they are, like we said at the beginning, they're very staggering. But why is it that these numbers are so significant?
So what I've heard since we've published the report from many people either affected by this personally or those working in the field in either clinical practice or in research as well, is that on the ground, they were aware that there was a big scale of a problem here. And the level of depression between the antenatal period and that postnatal period as well is really varies in how it's reported, because the scales are different and people's measurements are different and all of that. But it's up to 50% of dads experience depression in that period. And that's really staggering. And suicide itself is an extremely complex issue, and there is very, very rarely a single trigger point there. But we know that levels of depression is a real worry for us with this. But without having that national rate, it's very difficult to understand if this is a hidden crisis that's going on for these men and their families.
It's so sort of sad as well to think that it takes for it to get to like a crisis point or something, and you to be able to, well, I'm glad the door's opening in that regard. But so with the paternal suicide rate, does it reflect broader patterns in men's health, or is it just something you're looking at in this life transition period?
So we know that for suicide, up to 80% of all suicides are by men. And we know that the period of the lifespan when there's a peak in that risk crosses over with the age that men are becoming dads. And we know that so dads are becoming fathers later on in life, and then it's falling into that period of life where we have that highest risk point. We also know, so we found that there is kind of a rate of 12 per 100,000 of dads that were losing their lives to suicide. And that raised up to 15 if you were per 100,000 if you were a first-time father. So we know that that's a higher risk if you're a first-time dad. But in line with suicide research across the lifespan, across different groups, if you lived in areas of deprivation, those dads had double the risk of dying by suicide in that period. So we know things like deprivation are a real challenge to people's physical and mental health, and experiencing that struggle and strain of deprivation during that period significantly increases the risk.
And it's a huge transitional period as well, isn't it? That you kind of...
Yeah. So the reason I think that I have been drawn to thinking about life transitions as areas in the lifespan for concern and interest in research, and putting in evidence-based practices and policies, is that life transitions inherently come with lots of change.
Yeah.
And change can be really unsettling. There's lots of uncertainty involved in that. And when we think about the transition to parenting, the areas of your life that are impacted, I mean, they outnumber the ones that aren't. So your economic life is impacted, your partner relationship is often impacted, your family, your peers, your social identity, your work setting in general, all of that is in flux and in change. And in the midst of all that, you've got to figure out how to take care of this new human. And the majority of parents in this country now have not taken care of a baby until they have one, for example. So that's a big learning on the job situation. And the roles for dads has really changed over recent decades. And that's we can't ignore that has been a real change societally of our expectations for dads.
Yeah.
So we need to be putting in support for that as well.
Yeah, like, because the standards of what people would expect of fathers, you know, like you said, it is... Sorry to change it a little bit, but is there a percentage of fathers who experience depression then? I think you said that, sorry, didn't you?
So when we look across the antenatal and the postnatal periods, the rates vary depending on the measurements used, and that's a real issue in the area, and the populations that are studied, but it's up to 50%.
Gosh, and does this research then help you to understand more about this particular period, and especially, like you said, pre and post? You know, how tough is it for men then?
Well, it's significant when we think about the family systems and the family unit. So I think it's a zero-sum game if we start pitting maternal perinatal mental health against men's mental health over this perinatal period, for example. But if we look at the number of children that are losing their parent to suicide in this period, it's about 6 to 7 times more dads are losing their life to suicide compared to mothers. And that comparison is a very difficult one to make. And I think for me, it's much more important that we look at the family system.
Yeah.
And we know that where one parent in the perinatal period is struggling with their mental health, the odds of the other parent that is there also struggling increase. So when we think about best practice or areas that we should be looking at for intervention, then family systems approaches to perinatal mental health support seems a really important one for us to be looking at.
Yeah, and like you said, the whole picture, not just focusing not on the mum, not on the dad, or just looking at that. How do gaps then in awareness, you know, are they closing now? Are they, how is it being approached by different...
Yes, so I think there has been a shift in the discourse about men's mental health.
Yeah.
And there are, as I mentioned, amazing, wonderful charities that really push forward in terms of making sure there are safe places for men to talk about their mental health, that we deliver mental health support in a way that is accessible for men, and that we acknowledge areas of peak concern for them as well. So when we think about birth trauma, for example, I've spoken to dads where they have been handed the baby after birth when there is a complication with the mother going on, and the experience they have after that with PTSD of every time they hold their baby having flashbacks to a very traumatic event. It's really not surprising that lots of men then are experiencing the struggles of trying to support their partner, trying to be the parent for that child, and deal with what can be a very distressing time as well, on top of this overarching societal assumption for all parents that there's a real pressure for this to be the best time of your life. This isn't the most magical time. Isn't it the most incredible? And it can be those things or incredibly difficult as well. So I think holding all of those things to be
Do you
the case.
think that that's considered a barrier to, the societal pressures? Because like you say, there is that, it's magical what you're going through and there's an expectation.
Yeah. And I think to a degree there's some discourse of minimizing that and not recognizing that if you have any needs, physical or mental, over that period, that's a real issue as well. But I think there are real institutional and societal barriers as well. So we don't have that linkage between mental health records and becoming a parent. I think, and that says a lot to dads. And it's very difficult for men to access perinatal mental health services for themselves or specialist services. And that's a real lottery in terms of where you are and what the systems are. There's some nice trials going on, but that's what they are. They're not nationwide guidance. They're not nationwide policy. And even things like when you're having an appointment with your midwife at 12 weeks and they ask about mental health history, if you're not also asking about the partner's mental health history, whatever their gender or sex is as well, it is a loud omission. And so I think, whereas I see there's been great strides in the work of grassroots charities and the great work in terms of raising awareness, what I'm hoping that this national rate of suicide in this period does is actually galvanise the next push forward in having evidence-based provision and policies and practice.
Because I was going to ask, is there still that barrier in the father, because we're talking about fathers now, like actually seeking that help? Has that changed?
Yeah, I think there are I hear some pockets of fantastic practice. But I also hear the other side where if you have a father who recognises they're struggling, and it is a brave thing for anyone to come forward and say that they're really struggling with their mental health. If that is dismissed or battered away, or there is a difficulty accessing support when you've come that far to ask for it, that can be really damaging. So I think there is a need for education in health professionals that are working with families. There is a need for national tracking and monitoring and policies that directly acknowledge the risks of suicide in this population. And there is a need for making sure we have the best scales and measures and longitudinal studies that we've had for a long time in maternal mental health. And there are areas for great congratulation of improvement in mental health service for women, but there's also areas of significant challenge and need there as well. And so divorcing those, I think, is not necessary.
So that barrier then with, like you say, taking that first step, is that something that we're still struggling to overcome?
I think that definitely can be part of it, especially when the message there is to make sure you're there for the partner, which is a great thing to be, and make sure you're there for the child, which is a fantastic thing. I'm never going to say that those aren't great ideals and things to be supporting doing, but I think we do really well now comparative to previously in terms of recognising for mothers, in order to do that you need to take care of yourself and have the support when you need it in order to do those roles.
And like you say, focus on the family.
Absolutely. I think that family systems approach is incredibly valuable, and it allows for just nipping in the bud any conflict that's based on, well, if you recognise this risk, are you diminishing the other risk? And it's about recognising the needs of that family system.
Yeah, because every family's not, you're not going to get one and two the same, are you? Classic, isn't it? But you've talked a lot about some really promising charities and some promising interventions. Are there things that you think that we could still be doing better, or is that a silly question?
No, I don't think it's a silly question at all. I think it's a really important one. I think it's when you leave it to be as vague as we need more research.
I
think that can be really frustrating for researchers and the general public to hear. But I think, so for example, we have the first national birth cohort study that's in the UK happening starting next year, and that's the first one in 25 years, which is amazing. And it will be amazing if we, as part of that, included more around paternal mental health. the field of perinatal mental health has made really massive strides since the last birth cohort study. And I think for an example, is a great way to have, there's going to be over 30,000 families involved in that. So having the inclusion of paternal mental health in there more prominently, I think would be a wonderful start.
Yeah.
But actually just recognising when we're thinking about mental health research that we need to be including more of the fathering research as well, and the family systems approaches in there as well.
And I like that it's a collection, isn't it? Because you are, aren't you? When you have that baby, there is a collection of people around you that, you need for that. Looking ahead, based on what you found as well, are there any steps that we could be considering at community level, policy level, anyone that sort of stands out to you that we, basic next steps that we should be thinking?
I think something to keep in mind with this area is that these are preventable losses.
Yeah.
And if we start with that statement always, then that is a really powerful push for what we choose to do next. So I think individually, in terms of making sure that we're responsible in how we're reporting on this topic, and making sure that we have signposts to where support can be sought for these dads and their families is really important as a responsibility for us as researchers. In terms of thinking about what we can do societally, I think it is recognising that any of these life transitions that we're looking at, they often have this halo around them that can feel impenetrable and really oppressive of it needs to be the most magical experience, and if you're not, then you're not doing it right, and for goodness sake, don't voice that. We really want to get away from that and think about it. If at any point in your lifespan you are struggling, then there is support there for you, and it's okay to acknowledge that. It's really important, and there is support there. We can put that in front of people and engage with people, and that other side of it in terms of engaging with people where they are. So it might be that we see that the perinatal provision for dads needs to be adjusted and adapted so that it meets their needs.
Yeah.
And we're not just assuming that we'll copy and paste what might have worked in other areas of perinatal mental health.
It's crazy to think as well, isn't it, that something as simple as asking the dad, are you okay, could be a preventative measure.
Yeah. And I think for me as well, I would, in a dream world, I would absolutely love to see antenatal education being more widely available, more freely available, and including what we call low-intensity psychology interventions, but a public health approach of that for all parents. So public health approaches are where you don't wait for someone to have a diagnosis, you don't try and single out the people with a particular condition. Instead, you deliver what you think might be effective to boost everyone's mental health or well-being.
Yeah.
So delivering a public health low-intensity psychology intervention for all parents in that antenatal period that included recognition and understanding that mental health concerns are not rare in this time period, but there is support, and any losses from suicide from this are preventable if we get that support in place.
And it's amazing to think as well about, because you sort of one of the reasons I wanted to specifically ask about that 1001 is because you do go through a lot of changes in that 9 months, but you forget that there's more than just one of you, isn't it? When you're carrying a baby, yes, you are, but
absolutely,
it's so important that those, and like you say,
it's
staggering. I think this is such an interesting topic of conversation, but now you've got your birth study as well, you're going to have to come back. But just to say, if anybody has got any concerns or anything, please check out the description, because there are points of reference that you can contact. People can also reach out to us at the Healthy Aging and Chronic Conditions Research Institute. And
absolutely, I would say anyone who's struggling with their mental health, there is the Samaritans and Dad Matters, for example, that are wonderful charities, as well as 999 if this is a crisis of mental health, or 111 as well, and talking to your GP as well. I think it's there are areas of support, and they are there for you.
Please use them. Thank you so much. Unfortunately, that's all from us today, but thank you so much for coming in to talk to us, and thank you for given us such an interesting thing to go away and think about.
Thank you very much.
Thank you.